Bismillahirrahmanirrahim. Updated CME by Mother and Child Survival Group of Pakistan, Dr. Tariq, Ops Gynae Family Emergency Specialist, Gulf KSA, presently District Gynecologist. CME topic today very important. A patient presents in the labor ward with history of frank bleeding per PV, and before that she has also a history of cesarean section done for fetal distress. Now she presents in the before she also had an episode of bleeding PV but was managed conservatively. uh, Review, brief, management and evaluation. So such a patient is a case of antepartum hemorrhage, and the patient needs urgent intervention, management, evaluation and assessment, and with an intention to admit in HDU, ICU and NICU be standby. Evaluate the amount of bleeding by observing the vitals, pulse, blood pressure, temperature, pallor, anemia, and by inspection of the blood loss, and also mm, uh, ultrasound. And the ultrasound shows that the placenta is covering the uh, placenta is anterior, low lying and covering the os. So is a case of placenta previa, antepartum hemorrhage, bleeding due to that placenta. So she needs urgent intervention, management and resuscitation. A dedicated committed midwife for this dedicated midwife for uh, vitals, drugs, fluids, and investigations and other things. Take blood for 20 ml blood for investigation for blood fibrinogen, blood group, blood complete, blood sugar, urea electrolytes, and blood group, and fibrinogen and platelets and other things also. Double IV line with 14 bore cannula, and fluids to be given, and especially the crystalloids to be given at this time. Meanwhile, for the arrangement of blood, meanwhile senior obstetrician, senior anesthetist and senior hematologist to be informed. uh, Monitor the patient continuously, and check also if the patient is B negative, anti-D to be given, and book for CLE-hot test. And meanwhile, antenatal first dose of antenatal steroid should be given. And as blood has been sent on blood cross matching and arrangement of fresh blood, and maybe fresh frozen plasma if needed. Then ultrasound has been done, and it's seen that the patient is having placenta previa, low lying, covering the os. So one has to be very careful and monitor and evaluate the patient. After one day, there is another heavy sword of frank bleeding PV, and so it was decided to do the C-section. Brief review about the management. The As I told, that senior input of the senior obstetric consultant and senior obstetric consultant and anesthetist be involved, and all theater staff to be ready for this, and continuous monitoring of the patient, the vitals, fluid levels, catheterization, and urine measure of the vitals and the urinary output. And be preparation for the hysterectomy as well if the patient's bleeding not settled. Maybe chances of placenta accreta percreta, as there has been history of previous C-section. So after opening, uh, the lower segment approach is very difficult as because of the presence of big vessels, and the maybe vertical or inverted uterine in classical uterine in be needed. Avoid cutting the and shearing the placenta to avoid the blood loss. And also, placenta, do not try to attempt to separate the placenta. It should be left as it is, and the cord should be clamped close to the placenta, and injection methotrexate to be given into the cord. And for the hysterectomy, the placenta be be placed, and hysterectomy to be done. After that, prophylaxis for thromboembolic and blood transfusion and all that, and oxytocin should be given to reduce the atony of the heart, and broad spectrum antibiotics for prevention of sepsis, and meticulous notes should be documented for all what has been done. So it's a brief review management of a case of placenta previa antepartum hemorrhage. We'll come with another review later on. And the takeaway message is pray, praise, trust, love, worship Allah. Follow Asua Hasna sallallahu alayhi wa sallam, our health and survival. We must not forget our past. La ilaha illallah Muhammadur Rasulullah. Allahumma salli ala Muhammadin wa ala Muhammadin kama sallaita ala Ibrahim wa ala Ibrahim innaka Hamidum Majid. Allahumma barik ala Muhammadin wa ala Muhammadin kama barakta ala Ibrahim wa ala Ibrahim innaka Hamidum Majid. Wa kufa billahi wakila wa kufa billahi nasira. When we leave this world, we must recite La ilaha illallah Muhammadur Rasulullah. Allahumma ajarna minan nar. Thank you for your patience listening. We'll come with another review. Wama alayna illal balagh. Khuda Hafiz.